Africa's youngest nation, South Sudan, prides in rich biodiversity with lush savannas, swamplands, and rainforests teeming with wildlife. But beyond the natural beauty lies a persistent crisis, a crisis that has led to the loss of both human and animal life. Picture this, living in a region submerged in flood waters for nearly 5 years, where the situation worsens with every downpour. To appreciate the magnitude of the flooding in Unity State in South Sudan, we took to the skies. We're now flying 500 feet above ground. The area is heavily flooded and thousands of residents have been displaced. A majority of them are now residing in the internally displaced camps. There's also been an outbreak of cholera, and so far 11,000 residents have been treated. Bentiu, located in North South Sudan, has been nicknamed a drowning village, a forgotten paradise swallowed by water. These stagnant pools have become breeding grounds for waterborne diseases, with cholera being the most prevalent. Each time the heavens open, residents hold their breath, not in relief, but in dread of the losses and illnesses to follow. And when the rains fell in October 2024, the cholera outbreak escalated into a full-blown emergency. This is the MSF Cholera Treatment Center. Cries of ailing children fill the air. Thousands have sought treatment here since the cholera outbreak in late 2024. Doctors make regular rounds, ensuring that patients receive quality care.
Cholera is a waterborne illness, which means there is a bacterial contamination of the water sources. This can be highly attributed to the flooding, which the flooding have been overriding these freshwater sources all over the camp.
This is one of the pediatric wards in this cholera treatment center here in Bentu IDP camp. Over 2,000 cases have so far been treated since the declaration of the cholera outbreak in November 2024. In another ward, we meet 20-year-old Bechok girl, a resident of the Bentiu IDP camp. She came here after suffering severe stomach cramps.
I'm now feeling better after treatment. It's not like before. I pray my children won't suffer from this disease.
We head next to Bentiu State Hospital, where another cholera treatment center has been established. Entry health protocols are strict. You must sanitize before going in. The number of patients here has decreased, a good sign that treatment is working. Ruop Gatluak, 24, sits on his hospital bed, grateful to be alive.
When I was brought here, my body was in shock, but now I am doing well.
So far, this hospital has treated over 2,000 patients since October 2024 till January 2025, all of whom have been discharged. During this period, over 5,000 patients were hospitalized. As of 17th January 2025, a total of 2,312 patients have been treated at this facility, with 51 recorded deaths. The most affected age group is children between 2 and 14 years, accounting for 42% of all cases.
I come from Guit County, 20 kilometers from Bentiu. The residents there urgently need cholera vaccinations.
MSF was among the first responders when the cholera outbreak began.
So the people here in Bentu IDP camp are living in extremely precarious situations. There's a lot of overcrowding in the camp and extremely poor water and sanitation conditions, as well as an extremely fragile health system.
The cholera outbreak is deeply rooted in inadequate water and sanitation infrastructure. The uphill task for healthcare workers and the state is to prevent future emergencies.
So here in Bentu, MSF is focusing primarily on scaling up the case management capacity, so providing medical treatment to patients who have cholera. We have here in the Bentu IDP camp set up a cholera treatment center with a capacity of 100 beds.
Some of the activities we have implemented, especially in the community, has been one, the CATI, that is case area target intervention. is a system whereby we go to the community. Once we receive a patient from the community, that is XPOC precisely, once a patient is received, we go to the patient family, we disinfect and we hygiene hygiene kits to the ring. So we call it ring. We distribute hygiene kit to at least 5 households in the surrounding to ensure that the spread of the spread of the disease is interrupted in that community, in that family.
Despite the determination of health workers, critical challenges remain.
The main challenge that we've seen here is a weak coordination system and a slow and inadequate scale-up of the response. We found that the systems that usually coordinate emergency responses, as well as the partners on the ground, are chronically weak and underfunded, and it meant that there was not a fast enough response by other partners to help treat patients who have cholera and control the spread of the outbreak.
Closer to home, Kenya is also feeling the impact of the regional cholera crisis. The Ministry of Health has reported a total of 153 confirmed cholera cases along 3 counties, Migori, Kisumu, and Nairobi. Migori has recorded 53 cases, Kisumu 56, and Nairobi 44. These outbreaks are largely attributed to contaminated water sources, poor sanitation infrastructure, and the ongoing rain season, which has caused water stagnation and overflow of pit latrines, particularly in informal settlements. Health officials are warning that unless urgent interventions are made, the numbers could rise. In response, county governments have ramped up public health campaigns, emphasizing on hand hygiene, water treatment, and safe food handling. Cholera treatment centers have also been activated in affected areas with support from partners such as WHO and Red Cross Society. But even with these efforts, experts caution that climate-linked health emergencies like this one are becoming more frequent. They're calling for long-term investments in clean water and sanitation systems to curb future outbreaks. South Sudan, however, has faced the most severe burden of medical emergencies.
There is no magic bullet. Like that one thing I can say in the healthcare sector, anywhere in the world, you don't have one solution. So what do? My main aim it is to strengthen the healthcare system. If we have got a strengthened healthcare system whereby all the pillars are working, that way you will be able to prevent. Because prevention is actually way better than now trying to treat. South Sudan falls under the category of the UN categorization of the fragile member state, together with Congo, together with Somalia, and so forth and so forth. It is my interest eventually to graduate out of this. We graduate out of this by empowering and by enhancing system that we have, the healthcare system. And I'm very glad to tell you that we are moving along. When all these pillars are here, for example, now we have got a case of outbreak of cholera in our country. It was declared on 28th of October. So as we are sitting here, we have got a daily meeting or 2 days meeting at the national level. And then that one, we correspond with the subnational. This is where now like the Upper Nile state or the Unity state where the Bentiu County falls under. So the coordination mechanism we have here is the same thing that is translated into the subnational. And it's the same thing that goes all the way to the county, the same thing that goes all the way to the Boma and to the Payam.
Medical teams in South Sudan continue supporting Ministry of Health initiatives, including cholera vaccinations.
So one of the activities that MSF has participated in is supporting the Ministry of Health with a reactive mass vaccination campaign for cholera using oral cholera vaccines to further prevent transmission of the disease. MSF has supported the implementation of this campaign here in the Bentu IDP camp, in Rubkona town and Bentiu town, and we supported the vaccination of over 190,000 individuals against cholera.
Cholera outbreak is prone in these areas due to poor water sanitation and hygiene conditions in these areas. There is a call to action for international actors to come on board to help with humanitarian need. Ruth Munye, NTV, South Sudan.